Thanks for the opportunity to speak, and we'd like to add our respects and thanks to the traditional owners of this land, the CRANA people. It's great to see oral health on the agenda. It's certainly something that's near and dear to our hearts in remote health. This is going to be a very broad discussion. We talk about remote health, we talk about it nationally. So we don't talk about any specific programs in any specific states. It's quite difficult for us, but we try and keep that big picture. That's what we're here about. We will be talking about Aboriginal and Torres Strait Islander health, which we'll refer to as Indigenous health mostly, and specifically remote health, which we say is actually quite different to rural health, and I'll go into that a little bit later. As you can see, we actually did use lift the lip in our title. I'm oblivious, I'm not a dentist, I had no idea that meant so many things to so many different people. So I'm incredibly sorry if I pissed half the audience off before we even started. But, so that's what we're going to go through. It's obviously going to be a tag team between myself and Dr. Lee over there. And obviously, why we're talking about this is that access, as you've heard all day, and there's going to be a lot of repetition, that access is terrible in remote areas. I mean, let's call a spade a spade. We base most of oral health care on an urban privatised model, and that just doesn't fit into the environment where we work. It's an incredibly frequent reason for call-outs for remote area nurses and emergency departments across rural Australia as well. I was a remote area nurse in Maningrida recently, and most of the call-outs at 1 o'clock in the morning were for some poor bugger who had a really sore tooth, whether it was a child or whether it was an adult. And as a remote area nurse, I'm not trained what to do, and it's very difficult, so we just give them pain relief and send them on their way. That's pretty well all we do. I also work down at Lawn on the Great Ocean Road in Victoria, which is quite an extreme from remote area nursing. It's a boutique little, very well-resourced hospital, an hour and a half from Melbourne in a tourist area. And lo and behold, when I'm on night duty there as the only registered nurse in the hospital, what comes in the door but people with broken tooth and toothache? And it's the same issue. I still can't get them in to see a dentist. There's no one in Geelong, which is an hour drive away, and these people pretty well sit, so I was in the same boat. In another lifetime, I also worked for about 6 years with the International Committee of the Red Cross overseas, and one of the interesting programs that I did manage was actually providing a primary healthcare, oral healthcare focused program to the Tamil Tiger controlled parts of Sri Lanka. So there was no health systems there. We provided a mobile service. We had this poor dentist that we used to drag kicking and screaming across the front lines every day with a dental assistant and some primary healthcare team, and we would actually go and provide services to these areas. So I better actually get on with it. So what is CRANA Plus? We are the national professional body for remote and isolated health providers across the country. We're nearly 30 years old, so we've been around for a long time, but we existed in a different format. We used to be called CRANA, which was the Council for Remote Area Nurses. But in the last 18 months or so, the organisation's membership did something that was fantastic, and they decided that actually CRANA was about improving health for remote people, but CRANA stood for remote area nursing, and actually remote area nursing isn't what we were interested in. We were about improving health, and to do that it required everybody that's involved in healthcare in remote areas. So it changed its constitution, which was an amazing thing for an organisation to do. It's now CRANA Plus, and it is multidisciplinary. We do have dentists, we have doctors, we have one doctor, well, we have a few, 2 doctors, well, 3 doctors, oh gosh, they're invading. But we do have dentists, we do have allied health workers and the like, and we have a very broad concept as to what represents health and who is the health team. So because we work in remote areas, it might be a very important auntie in the town. She's probably the most important person when it comes to health in that community. And it might be the cleaners, it might be the person that drives the car. It might be that strange woman that sits in the foyer every morning. No one knows what she does, but she's there and she guides traffic, whatever it is. So we're open to everybody. Our organisation has 3 core principles that we work to, and that's that we advocate, that we educate, and that we support. We are federally funded for a lot of our programs. We also have programs that are funded by states and territories and others, and we are a membership-based organisation as well. So just to quickly go through some of the programs that we actually do provide, we have an education component, and we have something called the REC, the Remote Emergency Care Course. Now what we do there is we actually train whoever's working out in remote, we don't discriminate as to who actually comes to these courses. Skills that they need if they're in an area where they need to provide emergency care that would normally probably be provided in the urban area by an emergency physician. So we teach them those skills that they need to save a life. We also have a MEC program, a maternal emergency care, and we actually teach health providers again what a midwife would normally provide, or an obstetrician. But these aren't midwives and obstetricians out there, so we provide these skills to the people that need it. We also have a basic emergency care course, which is provided to often Indigenous people that live in that community. So it's very much like an Indigenous first aid type course, but to a higher level. They'll put drips in and do things like that, so it's to a higher level. I guess I like to describe it as these courses actually meet the needs of the clinicians out there when the shit hits the fan. And the shit hits the fan regularly. And when the shit hits the fan, you need to know what to do. You need to be able to have the skills to manage, because there's no point sitting back and saying, well, I'm a nurse and I know that you need this, this and this, but that's not my job, because this person will die, and it does happen every day in this country, which it shouldn't in such a wealthy country. We do provide a national standard for quality and safety in remote areas. That's what we would like to think we do anyway. So we provide this level, and it is being recognised. The coroner in the Northern Territory often refers to our courses in the investigation of a critical incidents which occur more commonly in remote areas of Australia, and has imposed the requirement for remote area nurses in the Northern Territory and Aboriginal health workers to actually undertake our course as a minimum standard. Another great course, another great service that we provide is the Bush Support Services, and there is some information out in the foyer there for you. And this is a free service that actually provides support to remote health providers, anybody who's working in a community of less than 5,000 people. It's a free service, it's a free 24-hour phone line that's run by psychologists who have experience in working with health professionals going through traumatic and difficult times, and it's 24/7. A good example is recent, well, not a little while ago, we had a remote area nurse who came and did the remote emergency care course, and then she did the MEC course back to back, I believe. So she did the maternal emergency care course, and she was driving back out to her community, which was probably 400 or 500 kilometres of dirt road. And we always tell people at the end of these courses to ring us with good news stories. What happened? What's occurred? And she rang back in and said she had a delivery. She delivered a baby, and she went through all of this saga about how fabulous it was. And it wasn't until the end of the conversation there was actually a cow on the side of the road. And so but hey, we didn't discriminate. Like, that was fun.